Hello, I am Dr. Paul Wiley, a neuropsychiatry and sleep medicine specialist in private practice since 1993, and medical director of Preferred Research Partners, a clinical research trial site located in Little Rock, Arkansas, with a new sister site in Fayetteville, Arkansas. Thank you for joining today's presentation, during which I am going to discuss shift work sleep disorder. About 25% of our nation's workforce participates in some form of shift work. Now, not everyone who engages in shift work experiences shift work sleep disorder. In fact, some people have a unique physiology that allows them to thrive working at night and sleeping during the day. But shift work sleep disorder does impact around 20 to 40% of people who work non-traditional shifts. Shift work occupations include, but are not limited to, emergency workers, healthcare workers, manufacturing plants, airlines and other transportation industries, miners, trucking, global athletes, and some service industries. People who suffer from shift work sleep disorder experience symptoms of excessive sleepiness during their shift, which impairs attention and concentration and reduces their work productivity. Shift workers can experience problems sleeping for a variety of reasons when attempting to rest during the daytime hours. Shift work can cause energy loss, headaches, impaired memory, and irritability. Shift workers can experience difficulty staying awake driving to and from work or other destinations. Shift workers often experience reduced productivity during their waking hours on their off days. And when able to sleep, brainwave monitoring of shift workers has demonstrated that the quality of their sleep that they obtain is never as good as it should be. Recovery from a single night of sleep loss from shift work is not a one-to-one process. In fact, it generally takes 2 nights of sleeping at a normal time for a normal number of hours, that is 8 to 9 hours, to restore baseline levels of physical and cognitive performance. Shift workers often experience reduced exercise motivation and decreased normal social activities with friends and family. Shift work exposes people to a variety of health risks, including an increased chance of developing mood disorders, diabetes, asthma, gastrointestinal disorders, and cancers, particularly breast, prostate, and colorectal cancer. In fact, there is an 11% increase in risk for developing colorectal cancer for every 5 years of having performed shift work. Other medical problems associated with shift work include reproductive difficulties, for example, erectile dysfunction, menstrual irregularities, and pregnancy complications. With shift work, there is an increased risk for developing obesity and metabolic syndrome, as well as cardiovascular disorders such as hypertension. Shift workers have a 3 times greater risk for having in a motor vehicle accident and workplace accidents, including patient care errors. And finally, rotating shift work can be particularly stressful on the body compared to working fixed shifts. One major factor contributing to the development of shift work sleep disorder is insomnia, which is trouble falling asleep and/or trouble remaining asleep. The insomnia is caused by trying to fall asleep during daylight hours instead of during the darkness of night, which disrupts our internal biological circadian rhythm. This generally results in people with shift work sleep disorder getting 1 to 4 hours less sleep per 24-hour day than a non-shift worker. During shift work, there is a mismatch between our internal body clock and the external environment, which affects the timing of sleep, the quality of sleep, and the duration of sleep. Normally, exposure of our eyes to sunlight each morning is what sets our 24-hour day clock. Sunlight turns on certain genes and turns off certain genes, and keeps them from making their alerting or sleep-inducing proteins and hormones. For example, it tells our brain when to begin and stop making melatonin, and throws off our cortisol production. A simplified description of how this works is that sunlight passes through the back of our eyes and goes to our master clock, which is called the suprachiasmatic nucleus, which is located in the hypothalamus of our brain. The pineal gland, located in our brain behind the hypothalamus, receives nerve signals from the suprachiasmatic nucleus, telling it that it is time to begin or stop secreting melatonin, which is our sleep-inducing hormone that is normally secreted about 2 hours before our normal non-shift bedtime. So you can see how shift work can result in the timing of melatonin secretion being thrown off and disrupting our sleep-wake schedule. A person officially qualifies as having shift work sleep disorder if the symptoms and problems I mentioned earlier have been present for at least 3 months, and if the symptoms interfere with performance at school and work, or disrupt social, emotional, mental, or physical functioning, or cause some other kind of significant distress. Our society's dependence on increasing productivity and providing health care via shift work is not going to change anytime soon. So once someone accepts the risks associated with performing shift work, generally in return for additional compensation or because it allows for enhanced care of family and kids, it is then best for the shift worker to do everything possible behaviorally to facilitate optimization of their sleep, performance, and safety. Preferred Research Partners is currently performing a 12-week clinical research trial on behalf of Axsome Pharmaceuticals of a once-nightly medication to help prevent the excessive sleepiness impact of shift work sleep disorder. We are testing medication to produce improvement in workplace alertness, in driving safety, improvement in mood and concentration, all while the medication hopefully does not interfere with sleep quality or sleep duration. This medication we are testing is already FDA approved for treatment of excessive daytime sleepiness associated with narcolepsy and with sleep apnea. If someone listening to today's presentation has shift work sleep disorder, or if they have a friend or family member who may have shift work sleep disorder and are interested in participating in this paid clinical trial, please contact Preferred Research Partners at 501-553-9987 or visit our website at www.preferredresearchpartners.com and provide your contact information, and our staff will reach out to you and provide additional information about participation. As always, I thank you for your interest and tuning in to today's Hope in the Pipeline, and I hope you have found it helpful and informative. If you know someone whom you think might benefit from today's discussion, please share it with them. We'll see you next time on Hope in the Pipeline.